Well, hi, I'm Jay Arthur, author of Lean Six Sigma for Hospitals and the QI Macros. You know, I think we're at this place in time where we can no longer wait 2 to 4 weeks for training and 4 to 6 to 12 months for projects to get done. We have to start making improvements right now. And at this moment, the coronavirus is causing all kinds of consternation in the nation, but I think it's especially true among healthcare professionals, because they're worried they're not going to be able to handle it if it really becomes a pandemic. So what's your choice? Well, your choice right now is to figure out, how do I start to streamline everything we do so that we can get people through into care in a timely fashion? And I'll tell you, the one thing patients hate more than anything in the world: waiting rooms. Waiting rooms. Right? Nobody wants to go into a waiting room, especially a bunch of other sick people there, and spend a bunch of time with other sick people. No, they want to be taken in. They want to get care. They want to be, either discharged or admitted into the hospital. And I can tell you, I've been doing this for quite some time. It's not that hard. All right, if you imagine this is the clinician, and these are the delays between things that are happening to the clinician, guess what? Most of the time is here. This is the patient waiting for something. So I want you to take your eyes off the clinicians. Do not try and make clinicians any faster. That's stupid. Watch your patient. From the time they walk in the door till they either leave without being seen, or they go through the whole process of admissions and triage and then diagnostics and getting them on into some sort of treatment. And if you watch them very closely, you'll find that they're sitting there for all kinds of time. 90% of the time that they're there, they're waiting on something to happen. And that's not because the clinicians are slow. It's because the care is not bumper to bumper, fast and easy. Back in 2004, Robert Wood Johnson Hospital won the Baldrige Award, but they were turning discharged patients in 38 minutes and admitted patients in 90 minutes. This is a far cry from what Press Ganey says the average length of stay in an ED is 4 hours, unchanged for a decade. Now, there are people out there who are actually doing this really well, like Virginia Mason. Go read about their story. Great story. Okay, so this can be done, and it can be done quickly. And all you need are the advanced technology for lean. Right? A little post-it notes, a little bit of time sitting around talking with each other about how you can accelerate the patient's journey. Accelerate the patient. And the funny thing about this is, currently I think healthcare is designed to try and optimize the clinician's time, the doctor, the nurse, or whatever. That's stupid. Optimize the patient's time. Because if you optimize the patient's time, you'll see lots more patients. You'll deliver lots more care. You'll immediately make all the clinicians more effective, more efficient, see more patients, do more good, and make fewer mistakes, which is what we're really looking for. Patient safety, and better outcomes, because it's timely. If you have a big full waiting room in your ED, that's not a good thing. That's a sign of bad management, bad running of the hospital, right? We want to be able to get them in and out. Now, the other thing too is you're going to have to get better at discharge. You're going to have to get better at admissions. You're going to have to get better at getting people out of the ED into a bed so they can be cared for and not just boarded in the emergency department. And then you have to go on diversion so that all these other things have to happen. No! Speed is the healing app. And if you learn how to embrace speed of the patient, not the clinician, the patient, I'm telling you what, you can create a superhighway for people to go through your emergency department or your doctor's office. I go to a doctor's office and, you sit there for 45 minutes with a bunch of other sick people. I don't want to do that. I want to walk in, sign my name, and be taken back into the care facility. So, that's my improvement insight for this week. Let's go out and accelerate the patient's flow. Let's go out and accelerate the patient's flow so we can get them into care, we can diagnose them, and make sure that coronavirus doesn't spread from sitting around in waiting rooms. Let's go improve something this week.